Hi, everybody. Dr. Demito here. I put together an exam review for you. I know that you all must be nervous as the first exam is coming up. I had been giving you some practice questions, but I thought the best way to help guide you would be to create and develop an exam review for you. I used to do this at the university I worked at before, and students really loved them. The main thing that I want to guide you and advise you of, if you follow the exam review and understand the concepts of the exam review, there isn't any reason you shouldn't do well on this upcoming exam. If you need any clarity on any of the slides, please let me know. And I would be so happy to help you. So these slides are going to be brief and to the point. I don't want to go over too many concepts because with the exam questions, they're not going over multiple concepts. They're focusing on a specific concept. So I don't want to go too far off or I may confuse you. All right, so let's move on and get this exam review going. All right, autosomal recessive. What does that mean? Autosomal recessive, and then there is when a child inherits a disease. That's autosomal. So it's inherited from both parents. So autosomal is both parents, and both parents have to be carriers of some sort. Okay, so look at this slide here. You see that father and mother are both unaffected carriers. That means that even though they do not have the disease themselves, they carry the gene that can then be passed on to a child. Now, if only father had the gene, wouldn't happen. Only mother had the gene, nope, wouldn't happen. They both have to have this specific gene. And this is cystic fibrosis is like this. What else? What else? What else? Of course, I can't think of anything else. Cystic fibrosis, and well, it'll come to me later. So, but that's that one. All right. Now, DNA formation. Where does the DNA actually come from? So, DNA formation occurs in what cell structure? Well, it occurs in the nucleus. That DNA develops and is created right in the nucleus of the cell. DNA replication. This requires the enzyme DNA polymerase. Now remember, anytime you see A's, that means it's enzyme, but I digress. So the DNA replication requires the enzyme DNA polymerase to travel along the single DNA strand, adding the correct nucleotide to a new strand. So you can see how this works. It's almost like a little factory where it goes down the line and it's giving the exact strand it should be. It just fascinates me to see how these concepts of molecular biology take place. I really enjoy that. Now let's talk about neural tube defects. These occur in fetuses. Oh, spelling is wrong. I'm going to have to go back and change. I don't know why my spell check was not working when I made these slides. So I'm going to have to go back and fix my spelling on this. But during growth and development, sometimes there are defects in the neural tube. What does that mean? It means that it does not close completely and it may leave an opening. And it can open at different spots. You can see by this slide how it's illustrated. It can be all the way up to the head where this opening is. And amniocentesis can indicate a neural tube defect when there's an increase in alpha fetoprotein. So you can do an amniocentesis, but also there are blood tests that are done today, and the blood tests look for elevated levels of alpha fetoprotein in the maternal circulation. There are also more specialized blood tests that can give much greater indicators of the risk of a neural tube defect in the infant. So what are we going to do to help prevent this? Well, we need to ensure that our our parents to be are taking in enough folic acid. Folic acid helps to prevent neural tube defects, and taking adequate amounts of this about 3 months prior to pregnancy can greatly reduce the incidence of these. All right. So, familial hypercholesterolemia. Um, what causes this? Well, there is a reduction in the number of low density lipoprotein LDL receptors on cell surfaces, and this is familial. I have a friend actually who has been on statins since the age of 17 because they have this particular condition, and nobody in their family now they've been on statins for a long time now. But when this first happened, nobody in their family had lived to 50. And that is essentially because they all had such elevated cholesterol that they were having heart attacks. So it was identified. It was put on, I think gosh, I don't know how many drugs she takes. But now she is in her late 30s and she's doing just fine. And with constant, review of her numbers. Okay, let's see. Where are we at here? Oops, not that one. All right, so breast cancer risk factors. And this is really important, especially if we have a patient who has a family member with breast cancer. This is very concerning. Okay, we want to, because I have an aunt with breast cancer. Does that mean that I'm going to get breast cancer too? So it can be really stressful. But when a woman has a first degree relative with breast cancer, her risk of developing breast cancer increases by 2. So what's a first degree breast relative? That's mother and sisters. So mother and sisters. That's really, when you're looking at breast cancer statistics, that's where the breast cancer specialists focus on, mother and sister. They don't look too far outside of that scope uh, in identifying cancer risk. I keep pressing the wrong mouse. Okay. Alcoholism and genetics. So there have been a lot of studies, adoption studies, um, and of all different types of populations with twins, different mental health conditions, schizophrenia. And they did a study on alcoholism and genetics. And these studies showed that an alcoholic parent, when raised by non-alcoholic parents, have a 4-fold increase in developing alcoholism. So what does that mean? When you have the offspring of an alcoholic parent, so you have a child who has a parent who's an alcoholic, and they're raised by, say, an adoptive family that does not drink at all, they still have a 4 times greater risk of becoming alcoholics themselves because of the genetic link with alcoholism. And there's a lot of it. A lot of things we have found are genetically linked. Now, gosh, 40 years ago when I was in school, when I was taking psychology, they were moving into genetics isn't the basis of these things. It's really life experience and blah, blah, blah. Well, now they've realized that, yes, genetics does play a very important role in patients' development of schizophrenia, alcoholism, personality traits. So another very, very fascinating topic. All right, colon cancer risk. Now, what is the greatest thing that we can do to reduce the risk of colon cancer? And remember, we're having conversations with our patients when we're doing these health visits, the annual visits once a year. They're a long visit. My doctor typically takes about at least 45 minutes with me, and he goes over a lot of concepts. And one of those teaching minutes is going to be colon cancer risk. Now, I get my colonoscopies like I'm supposed to. And an, another thing, to decrease the consumption of fats, of foods high in fat, can reduce colon cancer risk. So if you have risk factors related to colon cancer, it's in your family, da 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 da, reducing the amount of fat in your food may actually help reduce your risk of developing colon cancer. Alzheimer's disease risk. All right. So we also now are thinking that a patient's risk of developing Alzheimer's disease doubles when you have an affected first degree relative. So that's quite startling. This is a statistic that we did not know 10 years ago. 10 years ago, we were saying there was no genetic link between Alzheimer's, and now we're finding that that is not the case. All right. The data reporting sickle cell disease affects about 1 in 600 American blacks as an example of what kind of concept. And these things are important for you to know. The proper names. Remember, elevating the level of professionalism is very important in our field. As nurses, we want to be seen with respect. And so using the proper language is an excellent way to do so. So if we are going to be discussing a topic, for example, sickle cell disease, that approximately 1 in 600 American blacks suffers from sickle cell disease, that is an example of prevalence. So we may say prevalence studies suggest that approximately 1 in 600 Americans, blacks, suffer from sickle cell. So that is a way that we can elevate our level of professionalism as we are having conversations with peers. All right, let's see. I keep touching the wrong mouse here. All right. Blood pressure variations are associated with what? Now, I know most of you are ED nurses, and so I know that you're going to know this one. It is the renin-angiotensin system effect on vasoconstriction. So that is typically what affects those blood pressure variations. All right, genes and obesity. Again, studies have identified several genes that play a role in the prevention of obesity by affecting the regulation of appetite. So there are genes associated with obesity, and again, runs in families, and the regulation of appetite is a huge thing. Some people are hungry all the time. They never get that satiation point, and others are not ever hungry. So there is a link to that genetically. All right. The inflammatory process and edema. So the edema caused during the inflammatory process is caused by what? Now I'm sure you know this, increased capillary permeability. So the capillaries become more permeable and fluids are able to flow in at a much greater rate, causing that third spacing of fluid. All right. Oh, I don't have older adults and impaired wound healing. All right, so some older adults have impaired inflammation and wound healing because of the chronic conditions that exist. Now, older adults, as they move on in age, their immune system doesn't work as effectively as in younger people, correct? So they're at a greater risk of developing infection, period. But chronic disease that they may have increases that a lot. Now, I get a patient every once in a while in clinic, and I'm going through their medication list, and they take no medicine, and they're 80 years old, and I'll say, "You don't take any prescription medicine?" "Nope." "Wow, that's amazing. That's great. I'm so happy for you. You know that you're 80 years old and healthy, you don't need any medication." She still has an increased risk of infection, but not as much so as someone who suffered from chronic disease. All right. Now, you're going to learn how to read laboratory results in a different way. You read them in a specific way now as a nurse, and you will discuss the results with the physician, and the physician will decide what practice will be implemented due to the results of the labs. as a nurse practitioner, you're going to order specific labs because you're going to be trying to investigate a specific disease process. And when those labs come in, you're going to interpret them and identify what the disease process may be or treatment options that may be used. So when you're considering white blood differentials, an acute inflammatory reaction are related to elevations in neutrophils. So if you have a patient who has elevated neutrophils, you're going to automatically think of an acute inflammatory reaction. All right, next slide. What type of immunity is produced when an immunoglobulin crosses the placenta? And that is passive acquired immunity. It's called passive because there wasn't anything that needed to happen or occur. It just went. So passive acquired immunity is through the placenta. An individual is more susceptible to infections of mucous membranes when he or she has a seriously low level of IgA antibodies. And I didn't know that. That was something that I learned new as I was going through this material. All right. Why is the herpes virus inaccessible to antibodies after the initial infection? Why? Why do you think? Think about it. The herpes virus inaccessible to antibodies after the initial infection. Why is that? Well, the herpes virus doesn't circulate in the blood. It lays dormant on nerve endings. And so it's not free floating through the circulatory system to ever have any connection with antibodies. All right. What characteristics do atopic individuals have that make them genetically predisposed to develop allergies? So whenever you see the word atopic, always think allergy. And this is greater quantities of IgE. So think about tests that you would done. You have a patient come in, you suspect that they're suffering from allergies. Now, they've been coming into the office periodically with the same types of symptoms, and you want to draw some labs. Well, you may need to draw some IgE antibodies to identify if they are allergic to anything. I typically refer those patients to an allergist because the allergist knows best what they want to order and stuff like that, because it's not the type of patient that I see regularly. Okay, vaccines. Typically, vaccines require booster injections to maintain lifelong protection. Not always, but often. You know, we have to get our Tdap every 10 years. Some people need to get those boosters of measles, or hepatitis B boosters. So that happens. I wouldn't say 100% of the time. I would say some of the time. Okay. Oh, chemotactic factors affect the inflammatory process by directing leukocytes to the inflamed area. Think of leukocytes as warriors. Okay, they are the warriors that are in your body, and their job is to keep you healthy. So anytime anything happens in the body that might make you not healthy, they are going to arm themselves and head towards whatever's going on. So leukocytes are going to go directly to that inflamed area uh, when you have experienced an injury. What's the next one? Okay, so as we get older, there is a reduction of T cells in the older adult population, and this increases their risk of developing various infections. So T cells, they're very you learn a lot about T cells. If you're interested in autoimmune disorders, you'll learn a lot about T cells and how good they can be and how bad they can be too. But in the older population, they start to wane, and that increases their risk of developing infection. T cells are good at reducing infection. The only problem is in autoimmune disorders, it sees everything as an infection. So that's a problem with T cells in autoimmune disorders. All right. What is this? I think I made a boo-boo here. Oh, okay. So this is an example of an IgE-mediated hypersensitivity. So at a cellular level, this is what it looks like. There's smooth muscle contraction caused by histamine bound to H1 receptors. So H1 receptors, whenever someone is having an IgE-mediated hypersensitivity reaction and say goes into a bronchospasm, we're going to do whatever we can for those histamines, because that smooth muscle contraction is caused by histamine bound to H1 receptors. So we are going to give them an antihistamine. We are also going to give them Pepsid, because Pepsid is an H1 blocker. We have H2 blockers, which is a Benadryl, and then we have H1 blockers, which is Pepsid, because we want to block all of that stuff, H1 and H2. Zinc. Deficiencies in zinc can produce depression of B and T cells. Okay, everybody, had to take a little break. So let's look at the parathyroid hormone, okay? What imbalance lessens the rate of secretion of the parathyroid hormone? So think about it. If you have increased serum calcium levels, that's going to affect the rate of secretion, right? Because the parathyroid works on that negative feedback loop. So it is going to be determined how much is floating around in the system as to how much it needs to produce. So if you've got increased serum calcium levels, you're not going to have a parathyroid hormone that is secreting as much as it ordinarily would. Okay, let's see. Now, and hormones and negative feedback. Now, what if you have a faulty negative feedback mechanism? So now it's not working properly and you have a hormone imbalance. You can have excessive hormone production and the system won't turn off. So normally, if you have a feedback system that's working appropriately, once it reaches a certain level, bam, it gets shut off, right? Well, if it's not working properly, you can have that excessive hormone production going and going and going and causing lots of issues. All right, pancreatic cells and aging. The older we get, the pancreas, actually the formation of the pancreas begins to alter. So fat cells begin to take the place of the beta cells that are in the pancreas. One of the reasons there's an increased risk of diabetes as we get older, but fat cells are going to take up that space. Diabetes insipidus, I'm sure that you all know these signs and symptoms. So that's the patient that just is thirsty, 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 and then pees. They and just an enormous amount. So diabetes insipidus, diabetes mellitus, and syndrome of inappropriate antidiuretic hormone all exhibit thirst. So you've got those three conditions, both of the diabetes and then the SIAH. Those all are going to number one sign is thirst. Type 1 diabetes. The first laboratory test that indicates that diabetes is causing the development of diabetic neuropathy is protein in the urine. So that's one of the reasons we check urine so much. You know, back in the olden days, we didn't have the ability to check blood glucose. So we were looking for blood and urine. I mean, the glucose in urine, which is really bad because you've got to be really bad to have glucose in your urine. But now what we're looking for is protein, and that microproteinuria is what we're looking for. Causes of SIADH. So I should have removed this from that sign, but that's not what this is about. So we're going to be talking about laboratory values and SIADH. So if you have a patient that has that syndrome of inappropriate antidiuretic hormone, the serum sodium level of 120 microequivalents per liter and serum hypoosmolarity. That's what you're going to see on a laboratory value of someone with active SIADH. Graves' disease, you should all know this one. So you've got, with Graves' disease, you have a high level of circulating thyroid stimulating immunoglobulins. And then you know all of the characteristics, the bulging eyes, all of that stuff. But I really want you to concentrate on the high levels of circulating thyroid stimulating immunoglobulins. All right, the patient with Cushing's disease. These patients can have acne, they bruise easily, thin extremities, and truncal obesity. Those are common characteristics that you'll see in a patient with Cushing's. Balance and posture, the cerebellum is the area of the brain that is responsible for balance and posture. Sleep apnea. Someone who suffers from sleep apnea, those patients typically snore, they have low O2 in sleep, they don't sleep good, they're tired all day. Those are all symptoms of sleep apnea. Glaucoma. Glaucoma causes blindness because there's pressure on the optic nerve. So in patients who are suffering from glaucoma, we really want to know the eye pressure in these patients. That's how we determine the severity of the disease, and that's how we work as diligently as we possibly can to keep that pressure low. So there are eye drops that the patient will use to keep the pressure in the eye low. All right, muscular sclerosis and Guillain-Barré syndrome do have some commonalities between the two of them. They result from demyelinization by an immune reaction. So MS is actually an autoimmune disorder. Guillain-Barré, we really don't know a lot about it, but an immune reaction causes the demyelinization of these muscular cells. Pain inhibition. So, which neurotransmitters inhibit pain in the medulla and pons? Think about it. Norepinephrine and serotonin. The major sleep center of the brain is located in the hypothalamus. And CVA risk. What condition do you think puts a patient at the greatest risk of cerebrovascular accident? Do you think that it's diabetes or smoking? It's actually hypertension. So hypertension increases the risk of CVA immensely. Oh, here's another one of these. This in encephalocele. I can't say that well. But anyway, this is a herniation or protrusion of the brain and meninges through a defect in the skull. And you can see here, these are mainly photographs, but well, there are some photographs and then some drawings of it. And many times it can be corrected. Retinoblastoma. This is an eye tumor, typically happens in small children, and it is a genetic disease linked to a mutation in a tumor suppressor gene. So that's very interesting. That's pretty relatively new data. Tumor cell markers. These are hormones, enzymes, antigens, and antibodies produced by carrier cells. So this is what you're looking for if you're going in and getting a test, like a BRCA, to identify what your breast cancer risk is, or I can't remember the name of the prostate one. But that's what they're looking for. They're looking for those tumor cell markers. Cancer and chronic fatigue. or chronic inflammation. Sorry about that. Um, Colon, thyroid, and urinary bladder cancers are all associated with states of chronic inflammation. Stage 2 tumor. What is a stage 2 tumor? It identifies that the cancer is locally invasive. So it's locally invasive. It hasn't spread to regional structures yet. It's not confined to the origin of the cancer of origin. It hasn't spread to distant sites, but it still has invaded local tissues. The most common site of metastasis of a patient with prostate cancer is in the bone. Childhood cancers. They are most often diagnosed at peak times of physical growth. And think about that. Why does that happen? Well, there's a proliferation of cells, right? They're going through a growth spurt. So their body is really producing all of these cells, and the cancer cells grow right along with it. Children with cancer who undergo radiation therapy are at a risk of developing cancer as adults from the radiation therapy. All right. The function of the tumor cell marker is to screen individuals at high risk. And exposure to the Epstein-Barr virus actually supports a carcinogenic relationship in children who have been exposed to it. I didn't know that one before either. Now, the initial reproductive structures of the male and female embryo appear the same until what week? So you have a being, right, in your uterus. It's not male, it's not female until week 8. Week 8, it changes and it either becomes male or female. Ovulation is caused by a sudden increase of LH or luteinizing hormone. Hot flashes are caused by changes in estrogen. Pelvic inflammatory disease. It increases your risk of uterine cancer and also increases your risk or decreases your risk of being able to get pregnant. Okay, the first sign of puberty in boys is an enlargement of the testicles. All right, the most common infectious cause of orchitis in postpubertal boys is, can you guess it? Mumps. All right. And puberty in the vaginal lining, it becomes thicker. PCOS symptoms, well, there are a lot of, it's the leading cause of infertility in women. And symptoms are being overweight, very heavy periods, very painful periods, irregular periods. All of those things are hair on the face, hirsutism. HSV. The risk of transmission is present even in latent periods. So you don't have an active outbreak to be able to pass it. You can have a latent outbreak, which is the time before the lesions break out. You can still pass that on to someone. All right. The organism responsible for syphilis is Treponema pallidum. I know I'm not going to say that right. Treponema. I'm going to have to look that up and see how to say it, but I know I can't say that one. How long does a platelet live? 10 days. Tender lymph nodes and infection. It's because B lymphocytes are proliferating to try and keep you well. I tell that to my patients every day. If they have swollen glands, that's your body's immune system working well. It's sending all of these B lymphocytes to your lymph nodes to try to kill those invaders that are making you sick. Okay. The nutrients necessary for the synthesis of DNA and the maturation of erythrocytes is vitamin B12 and folate. Polycythemia at birth indicates hypoxia in utero. So think about that. You have a child that's born with excessive blood cells. They've got polycythemia, lots and lots of red blood cells. And the reason for that being is that the poor little body has been trying to compensate for hypoxemia in utero all this time. All right, B12 deficiency anemia can cause paresthesia um, as a result of the myelin degeneration in the spinal cord. Iron deficiency causes small, pale erythrocytes. Von Willebrand disease. Oh. This disease is caused by clotting factor 8 deficiency, and it's an autosomal dominant trait. Pernicious anemia. This is caused by the absence of parietal cells. And heparin inhibits thrombin and antithrombin 3. Yay! So this is your study guide. Just take it as it is. Don't try to read more into it than there is. And if you have any questions, please reach out. Good luck. And again, let me know if you have any questions.